Let me invite Dr. Ojo Moses, who is a consultant psychiatrist and the head of Drug Use Disorders Treatment and Rehabilitation Unit, Federal Psychiatric Hospital, Yaba, Lagos. Dr. Mozo is a seasoned consultant. He has seen it yesterday, he's seen it today, and will certainly live to see it tomorrow. Sir, you are welcome, and you have the floor.
I'll be speaking on the topic, an overview of drug abuse menace and its burden in the developing country. I'll be sharing our experience in Nigeria, and I think that would be a kind of representation of what may be obtainable in other developing countries, especially in Africa. As a form of introduction, I want us to look at what are drugs in relation to the other term that we use in addiction medicine, the term substances. Most times we use these terms interchangeably, and I will be, for most part of this presentation, be doing the same. But as a form of definition, drugs can be defined as any chemical substance that, when administered, affects the functioning of an organism. While substances, particularly psychoactive substances, can be defined as chemical substances that, when administered, alter the functions of the brain. So we are talking about drugs that have primary effects on the central nervous system when we talk about psychoactive substances. Or sometimes we just use the shorter term substances. And what are the functions of the brain we are talking about? Talking about mood, feeling, perception, thought, behavior, coordination, among others. So we can say that all psychoactive substances are drugs, but not all drugs are psychoactive substances. And we classify substances mostly when we talk about psychoactive substances classification regarding their effects on the central nervous system. But recent classification by the National Institute for Drug Administration in the US use this classification that you are seeing on the screen, where you have CNS stimulants. Examples include cocaine, amphetamine, methamphetamine, nicotine, and caffeine, among others. These substances tend to stimulate the central nervous system, producing euphoria, hyperactivity, and general increase in attention and concentration. We also have the depressants, the CNS depressants. Examples include alcohol, barbiturates, benzodiazepines, and the gamma hydroxybutyrate. These substances are usually, they tend to produce a depressant effect on the central nervous system. While you also have the cannabinoids, which include cannabis, one of the most abused drugs in Nigeria. And we also have the introduction of the synthetic cannabinoids in recent time, talking about cannabinoid-like substances, which are used commonly among young people in the country now. We have the opioids, which are commonly used as pain relievers. The use of these opioids is common now in as medical prescriptions when people present with pain or chronic pain and they are prescribed these medications. There is tendency for the medication to be, for the people to be addicted to them in the long run. We also have heroin and morphine among these. But the common one, in the country now, in Nigeria now, include tramadol, codeine, and for injecting drug users, pentazocine has been reported as one of the most commonly used opioids in our country. We have hallucinogens that has effect of producing hallucination-like effects on the brain. You have the LSD and ecstasy in this group. And lastly, you have the inhalants in form of paints, gasoline. These are volatile substances that can be inhaled to produce euphoric or pleasurable effect. We also need to look at the differences between drug use and drug abuse. I said drug use refers to controlled use of psychoactive substances or low-risk use of psychoactive substances. It is when a substance is used in moderate quantities or at low frequency, which does not cause harm to the person using, and it doesn't cause any form of dependence. On the other hand, drug abuse or harmful use is a pattern of drug use that increases the risk of harm or hazardous consequences to the user, or in some cases, even to people around them. It can cause physical or mental damage to the health of the person, which may include accidents, overdose, interpersonal violence, homicides, and suicide, to just mention a few of the consequences. We also have what is called polydrug use or multiple drug use or multiple substance use, which is use of more than one psychoactive substances, either concurrently, that is at the same time, or sequentially, one after the other. This is the common pattern of use among young people nowadays. Hardly will you see a drug patient or somebody who is dependent on drug that will be on one substance. Usually they take more than one. In some cases, some take more than 5 drugs in such cases. Then you also have hazardous use. That is use in quantities and frequency that puts the person's health in jeopardy. It can be a form of excessive use or prolonged use of substance, or use in combination, which can interact in a very dangerous way. For example, when you combine 2 or more CNS depressants like alcohol and opioid, that can lead to respiratory depression, respiratory arrest, and can trigger overdose death. Or use of substance in dangerous or unsafe manner. That example is when people inject. Some of them, they share needles, and in the process transmit infection from one person to the other. You also have high-risk drug use. This is a common term that is used to describe when people use drugs that are addictive in nature, that makes them to be prone to dependence or addiction. Or people who inject drug. These two groups of patients or people can be described as people who are high-risk drug users. Now, you also have dependence or compulsive use, which is what is generally referred to as addiction in common parlance. It is the pattern of compulsive drug seeking and using of drugs, despite the presence of severe personal and negative consequences. According to the Diagnosis and Statistical Manual edition, 5th edition, the 4 components of dependence are physical dependence, impaired control. That means the person is unable to control the use, continued use despite harmful consequences, and experience of social consequences, usually in the area of work, school, social life. Now, this changing pattern of drug use among, in recent times has shown that increasing number of young people are using drugs, especially in developing countries like Nigeria, where we have other social factors that makes young people to be prone to drug use. We also have observed that many people use multiple substances, especially young people. And they also increase number of high-risk drug users. In the past, what you have is people using alcohol, cannabis, tobacco. And I mean, the rate of use of very addictive drugs like cocaine, amphetamine, methamphetamine was very low. But with more drugs being available, many young people that they now have access to some of these very addictive drugs, including crack cocaine, and methamphetamine. There's also a changing pattern among children. More people who are very young, that you can describe as children below the age of 15, even as young as 11, 10, are now involved in drug abuse. And there's also an observation of increased use among women and the elderly. Another changing pattern is the introduction of the so-called new psychoactive substances. These are synthetic cannabinoids that sometimes when you test a patient for drug, when you screen them for drug, you may not find some of these synthetic cannabinoids because they are new substances which may not have been included in the kits that you are using. So one should be aware of the introduction of these new psychoactive substances that are usually called MPS. A very good example is Colorado, that is commonly used in Nigeria. The harmful effect of substances vary depending on the substance. In this environment, the most harmful substance of abuse are cannabis and opioids. Cannabis because about 70% of people who use illicit drugs use cannabis. And opioids because of their addictive nature and the tendency to cause more harmful consequences. In 2018, opioids accounted for about 2/3 of 167,000 drug-related deaths worldwide, and 50% of years lost due to disability or early death. Now, what are the risk factors? I'll quickly go through this just like any other chronic condition or non-communicable disease, there is no cause for substance use or substance abuse. But there are risk factors, which include family history of substance use disorder, probably in the first-degree relative, like the father or the mother or the siblings. Substance use in friends may also be a risk factor because of learning and modeling. Many of the patients will tell you that they get introduced into drugs through their friends or even their siblings, and in some cases, even parents. Parenting style, poor supervision by the parents, child neglect or child abuse can also be a risk factor. Then you can have peer influence, peer pressure, and peer rejection. Young people, they do not want to be rejected by their friends. And whenever they are with them, they just want to have a sense of belonging. When the friends are using, they also are compelled or they are encouraged to use. You also have environmental stressors, which is common in this environment, whereby there is a high rate of unemployment, high rates of lack of infrastructure, lack of recreational facilities. These are stressors that can be a risk, that can be risk factors for drug use. Mental disorders are also prominent in this, and it also include personality traits and personality disorders. The mass media and the social media has come to play a very big role in drug abuse in our environment, with many people being able to learn different types of drugs and route of use of drugs and how to use and how to obtain drugs, how to get access to drugs, even through the social media. Then you also have the sociocultural and religious factors. There is increasing prevalence of drug abuse in our society with attendant rise in negative consequences. This includes medical and psychosocial problems, which affect the individuals, but also affect the families and the society at large. Since the severity of drug-related problems have increased with the use of multiple and synthetic drugs, like I've said before, especially those who engage in high-risk drug use. The global disease burden, or global body of disease, has indicated that drug abuse contributes markedly to disability and mortality. In fact, mental illness and drug abuse or substance abuse or substance dependence were the leading contributors to global burden of disease. The 2019 report of global burden of disease indicated that about 11.8 million deaths were contributed by substance use disorders every year. And it also contributed to years lived with disability, YLD, which is the highest in that report. Substance use disorder were also the second highest contributor of life lost to premature death. That's all these factors, all these reports shows that substance use disorders are contributing to a high level of disability and mortality among people who are suffering from this problem. We also have medical issues like transmission of HIV and hepatitis B and C, which is common among people who inject drugs. And apart from this, substance use disorder is associated with mental health and social problems. So over the years, there has been an increase in drug use globally. According to the UNODC reports, in 2010, the reports of 2009 actually showed that 210 million people who are between ages 15 and 64 years had used drugs at least once in previous year. That gives a global prevalence of 4.8%. By 2018, 10 years after, the figure has risen to 269 million people worldwide, increasing the prevalence to 5.4%. This increase in prevalence is about 12% increase from 4.8 to 5.4. But when you look at the increase in percentage according to population, it's about 28% increase in population. In Nigeria, in 2018, 14.3 million people use substances. This gave a percentage prevalence of 14.4. And this is higher than the global prevalence reported in 2016 and 2018, which were 5.6 and 5.4 respectively. That means that the prevalence of drug abuse in Nigeria or drug use in Nigeria is higher than even the global average. So drug abuse has become a disease of public health concern due to its impact on the individual, family, and the society. Some of the reasons why we tend to have more problems with other chronic illnesses that seem to be more common in the developed countries, but they produce more negative impact in developing countries like Nigeria and others in Africa, is because of some of the socio-economic factors that also produce a kind of burden that will not allow affordability of treatment, access to treatment, and even lack of education on prevention. And so the risk of substance use disorder and negative consequences is increased with increased poverty, limited education, and social marginalization. Also, healthcare costs, which has been priced out of the reach of the common people, chronicity of the illness, because substance abuse or substance use disorder require lifetime, more or less lifetime management, and lack of health insurance to assist those people who have this disorder to have access to treatment. And the fact that family have to pay out of pocket to take care of their wards or children that or people that have mental health, substance use disorder, all this has made it more impacting in our society than the Western world or the developed countries. UNODC reports a high level of inequality has contributed to higher prevalence and poor outcome of drug abuse problem in the developing countries. The area of inequality identified by UNODC include non-availability of medical treatment. When people have opioid dependence, you now have medical treatment in the form of methadone and other medication that can help, like buprenorphine, that can help to manage this condition. But many developing countries do not have access to this medical treatment. You also have general barriers to treatment among women who are becoming an important population even in our own environment. Spread in developed countries, but negative impact is more severe in developing countries. This is also the projection for 2030 that by this year, low-income countries would have negative impact and higher population of people who have drug abuse problem. But what are these major factors that makes developing countries to be vulnerable, particularly, like I said, I'll be using example of Nigeria more in this discussion. Number one is rapid population growth. Increased population of people with drug use disorder, poor access to treatment, and the COVID-19 pandemic has really done a lot of damage to our health system. The of drug abuse to increase, and it has been very difficult for us to bring it down since COVID-19 pandemic. You also have low level of skilled healthcare workers. Many of our healthcare workers are leaving developing countries to the developed world for better condition of service. Influx of new substances and synthetic drugs, just like I said, example is Colorado, which is now very common among the young people. There's socioeconomic problems, unemployment, poor housing, because when we rehabilitate a patient, you need them to go back to the society to be reintegrated. But many of them may not be able to get back to get integrated easily because of unemployment, poor housing, stigma, and all these other social problems like this, even discrimination. Then you also have social media as an example of environmental factors that could be responsible. Rapid growth. The world population has been growing over the years. For example, in 2010, the estimated population of the world was 6.9 billion. And by 2020, it rose to 7. Now, for Nigeria, the population of Nigeria around 2010 was 226 million people. And by, the population of people who use drugs during that period was 226 million. By 2020, these are risen to 224 million, giving the prevalence of 5 to 5.6. We are at even the prevalence of 14.4%, which UNODC reported in 2018. The estimated prevalence gave an approximately 32.4 million people using drugs in 2018. Now, by 2050, the population of Nigeria is expected to rise to about 377 million people. Even if the prevalence does not even increase, if it remains at 14.4, which is not likely, it is likely that the prevalence will increase given our socioeconomic problems. At 14.4%, 54 million people, 54 million Nigerians will be using drugs by 2050. So then the other issue is the increase the number of young people. Drug abuse is common among age, and Nigeria has one of the youngest population in the world. So this vulnerable population will make the prevalence of drug abuse to increase in Nigeria. The same with our male population is on the high side. We have a higher gender ratio at birth in Nigeria than many other countries in the world. And the male gender is a vulnerable group for drug abuse. So all these factors makes us to be prone to higher rates of drug abuse. We also have poor access to treatment, which is a common problem in many developing countries, like even Nigeria. And like I said, COVID-19 pandemic also increased the. So what are the consequences of drug abuse? The consequences can affect the individual, like I said, the family and the society. But mostly medical effects affect the individual using the drug. And you can look at it from all the systems of the body. Drug abuse affects all systems of the body, including the central nervous system. These are some of the things that we see: psychiatric disorders, anxiety, depression, psychosis, cognitive impairments, including memory loss, withdrawal syndrome, encephalopathy. These are things that affect almost every system of the body. You have the gastrointestinal system, can have mouth in amphetamine, oropharyngeal cancer, and peptic ulcer disease in alcohol use disorder, liver cirrhosis in alcohol use disorder, pancreatitis in alcohol use disorder too, and hepatitis infection due to drug injection. And you can also have effects, psychological effect on the individual user. You can have a problem that may have preceded the onset of drug use. Many people try to use drug to medicate their psychological problems like depression, anxiety. So when you see psychological problem in an individual with drug abuse, it may actually be that the problem preceded the onset of drug use, and the person is actually using the drug to medicate the psychological problem. However, in most cases, drug can also precipitate psychological problems or psychiatric problems like irritability, aggression, violence, memory impairment, and all the rest. Then there is this case of A modificational syndrome, which is very common among young people who drop out of school because of chronic and heavy use of cannabis and resulting inability to persist in a task requiring prolonged attention. So many of them drop out of school because of lack of cannabis, which makes them to lose interest in their education. Social consequences usually can affect the individual, can also affect the family dysfunction, domestic violence, and all the rest. We can also have effect on the community, increase crime rates, increase healthcare costs to the community, increase level of communal violence, cultism, and gang wars. The intervention that we recommend vary from the individual to family to the society and even the government, and include the promotion of education, reducing risk factors, ensuring availability of screening among vulnerable groups. This is where the chemical pathology people, professionals, they are involved in ensuring that samples are collected in the proper manner, so that many drug patients tend to swap their samples when you ask them to go and bring samples. So laboratories should look at this. Training programs for vulnerable groups and their families, sensitizing clinicians to non-prescription drug abuse, provision of centers for treatment and rehabilitation, and promoting synergy between local, state, national, and international agencies in the field of drug abuse. Thank Thank you very much.
Yes, thank you very much, sir, for this very brilliant and well-loaded presentation. I think we were well educated to understand that drug abuse, the menace of drug abuse, is a problem that has pervaded all fabrics of our society. It's affecting both the young, the old, the women, the working class, and even the retired individual. And unfortunately, it is also affecting the students. I'm very much interested in this amotivational syndrome because sometimes you really cannot explain why some individual dropped out of school. And I'm sure chronic cannabis use is fully to be blamed. Thank you very much for this presentation.